It's a pleasure to be with you. The title of this talk is Boundary Spanning Leadership and Public Health Overview, Session 1. There are no disclosures for this presentation. Objectives include review the concept of boundaries as borders and gateways to new frontiers, review the 5 boundaries that are often associated with the Great Divide between groups and organizations, review the role of boundary-spanning leaders, describe the nexus effect, review the 6 skills of boundary-spanning leaders and how they relate to the tasks of managing boundaries, forging common goals, and discovering new frontiers, and describe the relationship between community engagement, adaptive leadership, and boundary spanning. Much of the content of this series on boundary spanning leadership and public health comes from a book by that name, Boundary Spanning Leadership, written by Chris Ernst and Donna Schrobo-Mason, published in partnership with the Center for Creative Leadership. This would be an excellent book addition to any leadership library. So what does boundary spanning leadership have to do with public health? This is a quote from an Institute of Medicine report from 1999. The determinants of health are beyond the capacity of any one practitioner or discipline to manage. We must collaborate to survive, as disciplines and as professionals attempting to help our communities and each other. This means collaborating between national, state, and local public health with other agencies of government that respond to all the determinants of health and multiple other organizations at the national, state, and local level. In 2012, the Institute of Medicine Expert Committee on Integration wrote a report. In that report, they described a continuum of integration from isolation to merger. Isolation means operating totally independently, with no knowledge of what other organizations are doing and have no contact with them. Awareness is when organizations are aware of what others are doing, but there is no other interaction. Coordination, collaboration, and partnership is a progression of interaction and interdependence of organizations with each other to accomplish common goals. Merger is the total integration of organizations. It's generally felt that most of our current programs and interactions fall into awareness and coordination areas. The Institute of Medicine stated that the U.S. needs to move from awareness and coordination to more collaboration and partnerships to effectively impact health and wellness in the United States. This slide lists effective public health system attributes for the future and stresses the importance of integration. Strong partnerships, effective channels of communication, system-wide objectives or collaborative strategies and goals, resource sharing through those collaborations and partnerships, leadership by governmental public health agencies. This leadership role means that public health should take a lead in facilitating partnerships between other stakeholders. Public health is well suited to do this at the national, state, and local level. This leadership role of taking the lead in facilitating partnerships with other stakeholders is a major goal of boundary spanning leadership. The last point on this list is to develop and use effective feedback loops to be flexible and adjust for better outcomes. Colin Powell said, "No battle plan survives engagement with the enemy," meaning that we always need to adapt, flex, and change to meet the needs of the current situation. Feedback loops are extremely important. This is a systems diagram showing the multiple stakeholders that need to collaborate and partner with public health to improve the health and wellness of the public. Once again, a major role of public health leadership is to facilitate those collaborations and partnerships. The concepts of boundary-spanning leadership will help public health professionals do that. According to Linsky and Heifetz's book, Leadership on the Line, leadership skills can be divided into two broad categories: technical leadership or management, and adaptive leadership, that I will also call extreme leadership. Both of these skill sets are needed for effective leaders. Knowing the difference and when to appropriately use them is extremely important. This slide lists some key attributes of technical leadership or management. Management solutions are fairly obvious, with a fix requiring minor adjustments, no major changes in the way things are done. Generally, people resist change, rising exponentially with a major overhaul. So minor changes will likely be less controversial in the organization than major ones. Things will continue much as they have in the past. In these situations, leadership can orchestrate the fix. They can manage it. The checkers are all on the board. They just need to be rearranged a bit. There may be some minor resistance in the organization, but these are not earth-shattering events that upset the apple cart. So managers face little risk of criticism, anger, and hostility with many technical management decisions. That is not the case with adaptive situations. Adaptive problems are often seen in times of crises. The solution to adaptive problems is not readily apparent. Adaptive situations and solutions need new approaches and major changes in the way an organization functions. A leader can throw all the technical management fixes they can generate at the problem, and it still persists. Adaptive problems require a group process to find an effective solution. So the role of the leader in an adaptive situation is not to line up the checkers. The leader must facilitate the group to find the checkers. This is actually true community engagement, facilitating communities to own their problems and solutions. Adaptive skills are essential for a leader to truly engage a target community. Adaptive leadership is also defined as extreme leadership. I want to reemphasize that effective leaders need both sets of skills and competencies: technical management skills and adaptive or group facilitation skills. According to Linsky and Heifetz in Leadership on the Line, the single most common source of leadership failure we've been able to identify in politics, community life, business, or the nonprofit sector is that people, especially those in positions of authority, treat adaptive challenges like technical problems. In other words, they try to manage their way out of situations that require group process. Understanding the difference between technical and adaptive skills and when to use them is critical for effective leaders of any organization. Boundary spanning is all about adaptive leadership. More detailed discussion of technical and adaptive leadership is covered in the leadership talks of the North Dakota Public Health Training Network curricula. Many organizations view their organizational boundaries as a limit for their activities and outreach, an impenetrable fence and barrier as diagrammed here, beyond which they cannot and should not operate. They consider the area outside the boundary as dangerous, inhospitable, a place to be avoided. Boundary-spanning leadership says this approach stifles creativity and innovation. Many groups look at these boundaries as necessary borders separating us from them, creating a great divide, as represented by this picture of the Grand Canyon. This great divide is often associated with a lack of trust, little respect for the other group, sense of no common purpose or goals, concern about perceived threats, and no bidirectional ownership. This great divide limits creativity, innovation, and change, ignoring collaborative and partnership opportunities that can transform organizational outcomes for both groups. Boundary spanning leadership defines 5 major boundaries: vertical, horizontal, stakeholder, demographic, and geographic. Leading across these 5 boundaries is the goal of boundary spanning leadership concepts. Boundary spanning leadership is defined as the ability to create direction, alignment, and commitment across boundaries in service of a higher vision or goal. Direction refers to creating shared goals and strategies for the collaborative or intergroup. Alignment means the joint coordination of resources and activities. Commitment relates to each group's commitment to the collective or collaborative group's success, something greater than the success possible by any individual group. A main point is that this approach must lead to a higher vision or goal that is beyond the ability of individual participating groups. They must be committed to work together in a new collaborative or partnership relationship. Boundary spanning leadership views organizational boundaries not as a barrier or closed gate, but as an open door to the outside, an exciting area of opportunity, innovation, and creativity, a new frontier. Boundary frontiers are where the most advanced thinking and breakthrough possibilities reside. Appropriate leadership of organizations open the gate between limiting boundaries and the limitless frontiers of creativity and innovation. Those frontier areas and opportunities can only be reached and realized through effective collaborations and partnerships with other groups. Boundary spanning leadership describes how boundary spanning collaborations and partnerships can result in a nexus effect, defined as the limitless possibilities and inspiring results that groups can realize together above and beyond what they can achieve on their own. The word nexus comes from the Latin word nectare, which means to bind, form a connection, link, or tie. In science, nexus refers to a specialized cellular connection that enables molecules and ions to pass freely between cells. Those two definitions capture what boundary spanning leadership means regarding nexus: a strong, interdependent connection of groups with a free bidirectional flow of information resulting in breakthrough ideas to enter new frontiers. The nexus area is sometimes messy, a situation where groups collide, discover differences and similarities, and seek to intersect and link for the common good. The role of the leader is to encourage and manage that interaction, including the inevitable conflicts that arise from colliding communities, cultures, beliefs, and values. If not appropriately managed, these colliding groups can easily spiral into an even greater divide. Boundary spanning leadership is not for the faint of heart. There are 6 skills or practices associated with boundary spanning leadership, each building on the preceding skills: buffering, reflecting, connecting, mobilizing, weaving, and transforming. By using these 6 sets of skills, a leader creates the direction, alignment, and commitment between groups to achieve critical organizational outcomes. This slide further defines the 6 skills of boundary spanning leadership. Buffering is clearly defining group boundaries, and by doing so, creating a safe space for each group. Buffering clarifies the various groups' identities and uniqueness. This is an essential first step before boundaries can be spanned. Reflecting refers to each group understanding their own and other groups' clarified boundaries, which helps foster intergroup respect and the development of strong relationships to weather the inevitable conflicts of the boundary spanning process. Connecting is when boundaries are suspended, which helps build intergroup trust. Mobilizing is the process of reframing new boundaries, creating a new intergroup community. Let's consider how the integration continuum diagram relates to boundary spanning leadership. Boundary spanning leadership techniques lead to increasing dependence of groups on each other, moving up the scale to collaboration, partnership, and in the ultimate scenario, merger, where old group community lines are dissolved or so interlaced that a new community group with a new boundary is formed. Boundary spanning leadership is a process of moving up the integration continuum to build interdependence of group participants. The techniques of weaving and transforming address that process. Weaving is the process of taking each group's unique boundaries and interlacing them. This process creates an interdependence where groups must rely on one another to accomplish the intergroup's vision and goals. Once the participating groups are interdependent, transforming is possible. Transforming is the creation of cross-cutting boundaries, cutting against the grain of the various groups' boundaries, which enables intergroup reinvention and the ability to enter the nexus effect. Groups manifest the universal, powerful human forces of differentiation or the need to feel unique, and the somewhat opposite balancing force or need for integration or belonging. In the boundary spanning process, unique groups expressing their own cultures collide. This collision of cultures, if managed well by boundary spanning leaders, utilizing the 6 skills or practices previously mentioned, can result in enhanced collaboration and foster incredible innovation and transformation. A boundary spanning leader's role is to build a bridge, to span the great divide between groups, turning the us and them into we, providing an appropriate space for the development of the nexus effect. The foundation for the bridge over the Great Divide includes manage boundaries, forge common ground, and discover new frontiers. These are the main tasks a boundary spanning leader must accomplish, and they relate to the 6 skills previously discussed. This table shows the relationship of those 3 tasks to the 6 skills of boundary spanning leadership. Managing boundaries relates to the skills of buffering and reflecting, forging common ground to connecting and mobilizing, and discover new frontiers to the skills of weaving and transforming. This slide describes the difference between community engagement and boundary spanning leadership. Community engagement facilitates existing communities to own their problems and solutions. Community engagement is the facilitation of a community process of problem solving. Boundary spanning leadership facilitates inter-community interactions that result in increased dependence on one another, creating new collaborations, partnerships, and communities to expand innovation. Community engagement is a necessary base on which the home of effective boundary spanning is built. Community engagement relates to the skills of buffering and reflecting, defining and understanding community boundaries and resources, building community confidence in problem solving, and affirming their identity. This is an essential base for moving on to the intergroup activities of connecting, mobilizing, weaving, and transforming. In summary, boundaries can either be considered borders or gateways to new frontiers. The 5 major boundaries include vertical, horizontal, stakeholders, demographic, and geographic. Boundary spanning leadership creates direction, alignment, and commitment in service of higher vision and goals. Effectively spanning boundaries can lead to a nexus effect, providing limitless possibilities and inspiring results that groups can realize together above and beyond what they can achieve on their own. Leaders must manage the human needs for differentiation and integration in the boundary spanning process. The 6 skills of boundary spanning leadership include buffering, reflecting, connecting, mobilizing, weaving, and transforming. Community engagement is a necessary base on which effective boundary spanning is built. Utilizing the 6 skills of boundary spanning, leaders will effectively manage boundaries, forge common ground, and discover new frontiers. Adaptive leadership skills are necessary for boundary spanning leaders. This completes the overview of boundary spanning leadership. Details will be covered by other boundary spanning leadership sessions of the North Dakota Public Health Training Network.